All right, so today we're diving into something a little um, unexpected. You guys sent in a book all about lasting longer in bed and how to deal with, erectile dysfunction.
Yep, that's right. And we're going to break down all the important stuff for you.
And while it's written for men, I think a lot of what it talks about, especially in terms of like sexual health and just general well-being, applies to everyone,
Oh,
right?
for sure. Definitely. It's about time we all start talking about this stuff openly and honestly.
Totally. So the book starts off by defining, erectile dysfunction or ED as like I think the term they used was the inability to get or maintain an erection firm enough for sex.
Yeah, they're pretty straight to the point, aren't they?
Oh, yeah. And while the book does mention a free ebook,
Hmm.
something about unlocking happiness through sexual well-being, it also makes it clear that sometimes ED can be like a sign of something more serious going on.
Exactly. It might just be temporary, especially if you catch it early, but sometimes it can be a sign of something else that needs looking at.
So it's not something to just ignore, right? But before we get into the potential causes, like how would someone even know if they're dealing with ED? What are the signs to watch out for?
Well, the most obvious one is, having trouble getting an erection in the first place, but it could also be having a hard time keeping it up, so to speak, during sex, or even just a lower sex drive in general.
Right, right.
Just
That makes sense.
Yeah.
Like if you're struggling with the physical stuff, it's only natural that your desire might take a hit too. And speaking of that, this is where things got really interesting for me. The book emphasizes that the causes of ED aren't always what you might think.
You hit the nail on the head there. It's not just physical, there's often a psychological component to it too. It's like a mix of what's happening in your body and in your mind.
So it's not just about age or some pre-existing medical condition, right?
Nope, not at all. Even just temporary stress, like at work or in a relationship, can have a big impact on how things work downstairs. It's amazing how connected our bodies and minds really are.
It really is. It's like, I think there's even a story in the book about a patient whose ED was directly related to his job stress. And once he learned how to manage that stress, his ED got better too.
That's a great example. It just shows how much our mental well being can affect our physical health.
Totally.
Yeah.
Now, on the physical side, the usual suspects are mentioned like diabetes, heart disease.
Hmm.
Um, there's atherosclerosis, which I had to look up. It basically means the arteries are hardening and narrowing because of plaque buildup.
Yeah, that'll definitely restrict blood flow, which is kind of important if you catch my drift.
Uh-huh, yeah. And then there are the lifestyle factors we all know about, like being overweight, smoking, drinking too much.
All that good stuff.
Yeah, all that good stuff. Oh, and certain medications can have side effects that affect things too. It's always good to talk to your doc about that kind of stuff,
For
right?
sure. Always good to be in the know. Now, on the psychological side, the book talks a lot about stress, anxiety, and depression. All that fun stuff that can throw off the balance we need for healthy sex.
And it doesn't stop there, right? It even talks about things like communication problems in relationships and even just low self-esteem playing a role.
It's wild, right? It really paints a picture of how interconnected everything is. It's not like we can separate these parts of our lives, they all influence each other.
Absolutely. And that actually leads perfectly into the book's whole focus on prevention.
Yeah.
It frames ED as something you can actually have some control over. I love that.
It's a much more empowering way to look at it, don't you think? Instead of just reacting to a problem, you can be proactive about it.
Totally. Yeah, it's about making choices that support your health overall.
Exactly.
Okay, so let's get down to the specifics. What kind of lifestyle changes does the book recommend for preventing ED?
Well, first and foremost, managing your weight. Carrying around extra weight, especially around the belly, can mess with your hormones and reduce blood flow, both of which can contribute to ED.
All right, so it's not just about looking good, it's about taking care of what's going on inside.
Exactly. And speaking of what's going on inside, regular exercise is huge. It's not just about building muscles, it's about keeping your heart and blood vessels in tip-top shape. That's essential for healthy blood flow, everywhere.
Uh-huh. So hitting the gym is good for your heart and potentially your sex life. Double win.
Now, gotta ask about this one because it seems to come up all the time, quitting smoking. What's the book say about that?
Pretty clear cut on that one. Smoking is bad news for your blood vessels. It damages them and restricts blood flow everywhere, including, well, you know where. So kicking the habit is a major step towards better sexual health.
Another one for the list of reasons to quit. Okay, what about alcohol? Where do they stand on that?
Moderation is key, according to the book. A drink or two might not have a noticeable effect, but overdoing it can actually make ED worse.
So it's all about finding that sweet spot. What other lifestyle changes does the book talk about?
Sleep. Turns out sleep disorders and ED are often linked. If you're always exhausted, your hormones can get all out of whack and your energy levels plummet. Doesn't exactly set the mood right. Makes sense. If you're dragging all the time, it's probably not top of mind. Okay, what about managing chronic illnesses?
Huge one. The book really stresses that if you're dealing with something chronic, like diabetes or heart disease, it's crucial to manage it properly. Following your doctor's advice, taking your meds, making healthy choices, all of that.
Yeah, because those conditions can directly affect blood flow and your overall health, which, as we've seen, are tied to sexual function.
Right on. And then you've got your blood sugar, blood pressure, cholesterol. Keeping all those in check is vital for good cardiovascular health. And as we've talked about, that's linked to sexual health as well.
And they also talk about addressing any prostate problems.
Exactly. Prostate issues can also lead to ED, so it's important to get regular checkups and talk to your doc about any concerns you have.
Okay, so we've covered a ton on preventing ED through lifestyle. But, I'm sure some people listening are wondering about ways to, boost their sexual performance in general, even if ED isn't really an issue for them.
You know what? The book actually gets into that too, and it has some pretty interesting insights.
Oh, okay, I'm all ears. What are some of the highlights?
Well, the first thing they emphasize is relaxation. It's all about focusing on enjoying the experience and making sure both partners are happy, not just about how long you can last.
That makes sense. If you're too focused on how you're performing, you're probably not really present in the moment.
Exactly. And this is where the book suggests something that might surprise some people. They suggest masturbation as a way to practice lasting longer.
Interesting. I can definitely see the logic behind that.
Right. It's all about getting to know your own body and responses and, gaining a sense of control.
Makes sense. So what other tips does the book give for enhancing performance?
Well, they talk about cardio, like running and swimming, as great ways to boost your libido and stamina.
So those endorphins are good for more than just a runner's high. What about diet? Do they say anything about what to eat?
They do. Actually, they even suggest specific foods to include, like garlic, onions, bananas, chili peppers, and foods rich in omega-3 fatty acids.
Really? Anything specific about why those are beneficial?
Some of them, like garlic and onions, are thought to help with blood flow. Bananas are packed with potassium, which is good for muscles. And then the omega-3s, they're good for heart health overall.
So it's all about giving your body the nutrients it needs to perform at its best, inside and outside the bedroom, I guess.
Exactly. And they also mention the importance of getting sunlight and fresh air.
So maybe skip the Netflix and chill night and opt for a hike and makeout session. I can get behind that. Okay, but what about the emotional side of things? The connection between partners. Does the book touch on that at all?
It does, actually. It really stresses the importance of connecting with your partner and understanding their needs. It's not just about your own pleasure. It's about a shared experience where both of you feel satisfied.
And that probably involves, like, having honest conversations about what each person enjoys.
Right, exactly. And the book even suggests talking to a professional, like a sex therapist, if communication is a challenge.
So it's okay to ask for help when you need it, which is never a bad thing. What other good advice does the book have?
Well, they talk about trying new things to shake up your routine. They even mention role-playing as a way to add some spice to things.
Sounds fun.
And then they also talk about building confidence. Feeling good about yourself can go a long way in feeling more comfortable in intimate situations.
Makes sense. And they mentioned experimenting with different positions too, right?
Mm-hmm. They even suggest Kegel exercises, specifically for men, to strengthen those pelvic floor muscles.
For anyone who doesn't know, Kegel exercises are those where you squeeze and release the muscles you use to stop peeing.
Exactly. They can help with bladder control and, according to the book, can also improve sexual performance by making those muscles stronger.
So we've got a whole arsenal of tips and tricks now. But the book also stresses one really important thing: patience.
Right. It takes time to make these changes, to build confidence, to communicate better.
It's not like flipping a switch. It's a journey.
For sure.
All right. So we've talked a lot about prevention and making lifestyle changes, but I know there are cases where people need actual medical help for ED.
Absolutely. And that's a super important point. Everything we've talked about today is just for information. It's not a replacement for talking to a doctor. If you're struggling with persistent ED, it's essential to get professional medical advice.
Couldn't agree more. But I know talking to a doctor about this stuff can feel kind of awkward, right?
Oh, definitely. But the book actually tries to help with that by giving you a detailed guide on what to expect when you go to the doctors.
So it's like a roadmap for navigating that conversation.
Exactly. They break down the whole process, like what questions the doctor might ask, the different exams and tests they might do. Knowing what to expect can make the whole thing a lot less stressful.
I bet it does. So can we talk a little about some of those diagnostic methods the book talks about?
Sure, it all starts with a physical exam. The doctor will check your penis, testicles, and nerves to see if anything's out of whack.
Okay, that sounds pretty thorough.
It's all about getting a complete picture, right? And then they'll usually run some tests.
Like what kind of tests?
Well, they often do blood tests to check your testosterone levels and make sure you don't have other conditions like diabetes or heart disease.
Makes sense.
They might also do urine tests to check for infections or other things that could be playing a role.
And I think they even mentioned doing an ultrasound.
Yeah, they can do an ultrasound specifically of the blood vessels in the penis to check for blood flow problems.
So they can actually see if there are any blockages.
Exactly. Sometimes they even do this test along with an injection that gives you an erection so they can really see how the blood is flowing when you're aroused.
Wow. They really do look at things from all angles.
They do. There's also something called an erection test, where you wear a special device on your penis at night. It tracks how many erections you have while you're asleep and how strong they are.
So they can see how things are working
Mm.
even when you're not consciously trying to have an erection.
Yep. And in some cases, they might even do an electrocardiogram or EKG to check for any heart problems, since heart health and sexual health are so closely linked.
Right. And I remember them mentioning a psychological exam too.
That's right. It's not just about the physical stuff. They want to understand the mental and emotional side of things as well.
Again, shows how connected our physical and mental health really are.
Absolutely. Can't really treat one without considering the other.
So once the doctor has all this information from the exam and all the tests, they can start figuring out a diagnosis and recommend treatment options.
Exactly. And that's where we'll pick up in the next part of our deep dive. We'll explore all the different treatment options the book outlines. Stay tuned.
All right, so we've laid the groundwork.
Mm-hmm.
We know erectile dysfunction can be both, physical and psychological. And we've seen how much lifestyle choices can really affect things. Now, let's talk about the treatments. I know a lot of people are probably curious about that.
Yeah, the book goes into quite a bit of detail about different treatments. It starts with what are often the first things doctors try, oral medications.
I'm guessing those are the ones most people are familiar with, like the little blue pill and all that.
You got it. Those medications work by relaxing the muscles in the penis, which allows more blood to flow in and, well, helps a man achieve and maintain an erection.
So it's kind of like giving the body's natural processes a little nudge in the right direction.
Yeah, that's a good way to put it. The book mentions a few specific meds, some you've probably heard of, like sildenafil, which is better known as Viagra, and others like tadalafil, avanafil, and vardenafil.
I'm sure these medications aren't for everyone, though, right?
Yeah.
Are there side effects people need to be aware of?
Oh, absolutely. The book's pretty upfront about that. It lists potential side effects like headaches, changes in vision, upset stomach, stuffy nose, flushing, that kind of thing. It also makes it clear that these medications can interact with other drugs, so you always got to talk to your doctor about your full medical history before starting any new medication.
Yeah, that's super important. It's not as simple as just taking a pill and expecting everything to be perfect.
Exactly. It's all about finding what works best for you and understanding the potential risks and benefits, which is why talking to your doctor is so important.
For sure. So what if those oral medications don't work, or if someone can't take them for whatever reason, what other options are there?
Well, the book talks about a few other things. One is self-injections with a medication called alprostadil.
Injections, huh? That sounds a little intense. How does that work exactly?
It basically involves injecting the medication directly into the base of the penis, and it usually causes an erection pretty quickly.
So it's a more targeted approach than taking a pill that has to travel through your whole system.
Yeah, you could say that. But like any medical procedure, there are risks. The book talks about potential bleeding at the injection site, erections that last too long, and even the possibility of developing fibrous tissue at the injection site over time.
So not something to be taken lightly, for sure.
Right. And there's another method that uses alprostadil too, but it's a little less invasive. It's called a urethral suppository.
Okay, I'm not familiar with that one. What is it?
Basically, it's a tiny pellet of medication that you insert into the opening at the tip of the penis. Still less invasive than an injection, but it also has potential side effects like bleeding, pain, And similar to the injections, the possibility of fibrous tissue forming inside the penis.
Seems like with any of these options, you're weighing the potential benefits against the potential downsides.
Exactly. And that's a conversation to have with your doctor. They can help you figure out what makes the most sense for your situation.
Definitely. Are there any other treatments they talk about that use medication?
Yeah, they mentioned testosterone replacement therapy, but that's really only for guys who have low testosterone, which, can contribute to low libido and ED.
Right, so it's about correcting a deficiency, not just boosting testosterone in everyone.
Exactly. And it's worth noting that testosterone therapy has its own set of potential side effects too, like acne, breast enlargement, pain in the penis, and even problems peeing. So it's not a one-size-fits-all solution.
Definitely not. Okay, so we've talked about the medication options. What about things that don't involve medication?
Well, one thing the book mentions is penis pumps, which I'm sure some people have heard of. It's basically a device that creates a vacuum around the penis, which draws blood into the area and creates an erection. Then you put a ring around the base of the penis to keep the blood there and maintain the erection.
I imagine that can feel a little awkward. Are there any risks with using those?
The book does list some potential downsides, things like problems ejaculating, bruising, and even a cold penis. So, yeah, not always the most comfortable solution.
Got it. Maybe not ideal, but an option nonetheless. What about more permanent solutions? Does the book talk about any of those?
They do discuss penile implants. Basically, these are devices that are surgically implanted to help men get erections.
That sounds like a pretty big step.
It is. Usually, it's only considered if other treatment options haven't worked. There are two main types: inflatable and semi-rigid. Inflatable implants let you control when you have an erection and how firm it is. Semi-rigid implants keep the penis firm all the time, but it can be bent.
So different levels of control and flexibility, I guess.
Exactly. But like with any surgery, there are risks, infection, mechanical problems with the implant, that kind of thing.
So it's a decision to really think carefully about.
For sure. And then lastly, there's surgery on the blood vessels themselves, but that's pretty rare. It's only for men whose ED is specifically caused by blockages or leaks in the blood vessels of the penis.
So it's like a very specific plumbing job.
Yeah, basically. But it's still surgery, so it has all the same potential risks and complications as any other surgery.
Okay, so we've covered a lot of ground here: medications, devices, even surgery. But before we move on, I know some people might be wondering about natural remedies. Does the book touch on any of those?
It does mention a few, things like herbal supplements like Panax, ginseng, and Rhodiola rosea, which some people claim can help with ED. But the scientific evidence on those is pretty mixed.
So no guarantees there. And it's important to be cautious with those,
Oh
right?
yeah, definitely. Always talk to your doctor before trying any herbal supplements, especially if you're already taking other meds. There could be interactions you don't know about.
Good point. What other natural remedies do they talk about?
Well, there's DHEA, which is a hormone that can be converted into estrogen and testosterone in the body.
So the idea is that it could boost testosterone, which might then help with libido and erectile function.
That's the theory, but the research on how well it works for ED is still pretty limited.
What about L-arginine? I've heard that mentioned in connection with ED before.
Yeah, they talk about that one too. It's an amino acid that helps the body make nitric oxide.
And nitric oxide is important because it helps relax blood vessels, which can improve blood flow.
Right, so some people think L-arginine might help with ED by increasing nitric oxide and improving blood flow to the penis.
Okay, so potentially another way to help the body do its thing.
Exactly. And then there's acupuncture, which is a traditional Chinese medicine technique.
I know acupuncture is used for a lot of different things, but how does it supposedly help with ED?
It's thought to work by stimulating nerves and improving energy flow in the body. Some people believe that might then have a positive effect on erectile function, but more research is needed.
So again, not a sure thing. What about zinc?
The book mentions zinc supplements, but mainly for guys who actually have a zinc deficiency. Zinc plays a role in testosterone production, so if your levels are already normal, taking extra zinc probably won't make much difference.
Got it. More about fixing a problem than boosting something that's already working fine.
Right. And as always, talk to your doctor before taking any supplements, including zinc, just to make sure it's safe for you.
Good advice for any supplement, really.
Couldn't agree more. It's always best to check with your doctor first.
Okay, so the takeaway here is that there are some natural remedies out there, but it's crucial to talk to a healthcare professional before trying any of them.
Definitely. It's not about self-diagnosing and self-treating. Professional medical advice is key.
It's a good reminder to step back and remember the book's main message, which is that ED is common, and it's often treatable.
That's such an important point. It's nothing to be ashamed of or to suffer through alone. There are solutions out there.
And a lot of times it comes down to overall health and lifestyle.
Absolutely. Taking care of yourself can go a long way in improving ED, and you might even boost your overall well-being in the process.
It's like taking a holistic approach, looking at the whole picture.
Exactly.
Now, we've covered a ton of information today. What are
Mm.
some of the main things that stand out to you from all of this?
For me, it's that reminder that ED isn't just physical, that mind-body connection is so strong, and sometimes dealing with stress, anxiety, and relationship stuff is just as important as addressing any physical factors.
I agree. That story about the guy whose ED was tied to work stress really stuck with me.
It really shows how connected everything is.
Another thing that stood out to me is how important communication is, both with your partner and with your doctor.
Yeah, I couldn't agree more. It might be hard to talk about this stuff, but it's so important if you want to find the right solutions.
So that everyone listening, if you're dealing with ED, you're not alone. And even if you're not personally going through it, I think this conversation has given us all a lot to think about when it comes to sexual health and well-being.
For sure. It's definitely a conversation worth having.
Now, as we wrap up this part of our deep dive, I want to leave you with something to think about. This book focuses mostly on the physical and medical side of ED, but what about intimacy and emotional connection? How do those things affect sexual function? And what can we do to strengthen those aspects of our relationships?
Those are such great questions. They really highlight that sexual health is about so much more than just the physical. It's about connection, communication, and intimacy.
And nurturing those parts of our relationships can lay the foundation for a more fulfilling and enjoyable sex life. It's not just about the mechanics, it's about the emotional connection that keeps things exciting.
It's a perfect way to put it.
Yeah, it's about so much more than just the physical side of things, isn't it? It makes you realize that you got to nurture all those different parts of a relationship.
For sure. It's about building that foundation where both people feel safe and connected on a deeper level. And, when that's strong, the physical intimacy often just falls into place more naturally.
So true. Well, as we wrap up this deep dive into lasting longer and dealing with ED, I hope everyone listening has a better, more well-rounded understanding of all this.
We've covered a lot, haven't we? The physical and psychological causes, those lifestyle factors, and all those treatment options, meds, devices, even surgery.
And we can't stress enough how important it is to talk to a doctor if you're dealing with ED consistently. This deep dive is just a starting point, right? It's meant to inform and get the conversation going, but it's not a replacement for actual medical advice.
Exactly. Keep that conversation going, not just with your partner, but with your doctor, too. Being open and honest about it is so important for finding the right solutions.
And remember, sexual health is part of your overall well-being. It's worth paying attention to and seeking help when you need it. There's nothing to be ashamed of.
I couldn't agree more. Taking care of your sexual health is just as important as taking care of any other part of your health.
Well said. So everyone listening, I hope you found this deep dive helpful and maybe even a little empowering. It's a topic that can feel kind of taboo, but we think these open and honest conversations are so important. We got to break down those stigmas and help people live healthier, happier lives.
And don't forget, knowledge is power. The more you know about your body and your health, the better choices you can make.
Absolutely. All right, that about wraps up our deep dive for today. Keep sending in those questions and keep those conversations going. Until next time, take care of yourselves and don't be afraid to explore all aspects of your health, including your sexual health.